Assalamualaikum and good morning, everyone. A very warm welcome to all the participants, distinguished speakers, and colleagues to this morning breakfast webinar section. So thank you for joining with us. My name is Mila. Htay. I'm a senior lecturer from the Department of Social and Preventive Medicine. I'll be serving as the moderator for this morning breakfast webinar section. The title of the talk today is World Health Day 2026, Together for Health, Stand with Science. It is my great pleasure to introduce our distinguished speaker, Professor Dr. Rafdzah Ahmad Zaki. Prof. Rafdzah is a professor in the epidemiology and public health with an extensive experience in implementation research. Professor Rafdzah work focused on the infectious disease, One Health approach, and digital health innovation. She has been recognized among the world's top 2 scientists and continue to advance the evidence-based solution throughout the research, training, community engagement project, as well as the global collaboration research project. Without further delay, I would like to invite Prof. Rafdzah to deliver her talk. Professor Rafdzah, the floor is yours. Thank you.
Assalamualaikum and good morning. Thank you, Dr. Mila, for the introduction. So this morning I'll be speaking on World Health Day 2026, which actually we celebrated yesterday on the 7th of April. So let me share my slides now. Okay, so like I mentioned earlier, so the today's talk is about World Health Day that we actually celebrated yesterday, and the theme for the World Health Day for this year is Together for Health, Stand with Science. So this theme is particularly important in today's world where we are facing increasingly complex health challenges and where the role of science and collaboration has never been more critical. So in this session, I will share what these themes means, why is it matter, and how we can translate this into action. Right? Okay. So why does World Health Day matters? The WHO celebrate this every year with different themes. Yeah, and why it is important? Because firstly, it represents a global milestone. So it is celebrated every year on the 7th of April, and it actually marks the founding of the World Health Organization itself, started back in 1948. And second, it raises awareness. So each year it highlights a different critical health issue with a different things. So this will bringing attention not only to policymaker but also to the public and the key stakeholders, because awareness is the first step towards change. And the third, with the awareness of particular issue, this will drive into action. So World Health Day is not just about discussion. It influences policies and promotes evidence-based solutions that can improve health outcomes. And importantly, it mobilizes collaboration. It brings together governments, academia, communities, and global partners, because health challenges today cannot be solved in isolation. Right? So every year with a different theme. So the WHO hope that globally we are focusing on that specific issue that they want us to focus on. So today's or this year theme is on Together for Health and Stand with Science. So let's look into why this theme was selected. Yeah. So at the first glance, it may sound simple, yeah, but it's actually bring together two essential ideas that must work hand in hand. So the first, I will focus on Together for Health. So health is not created by the healthcare system alone. So it is shaped by many factors, yeah, our policies, our communities, our environment, and the collective action that we take across the sector. So this part of the theme remind us that no one can address today's health challenges alone. So we are dealing with pandemic, climate change, or even the rise in chronic diseases. So these are complex issue, interconnected issue. So they are require collaboration across government, academia, communities, all the stakeholders, and at a different level. We need a global partners. We cannot just focus in, let's say, a problem in our country alone. Yeah, we need to be aware of what are the global problem, because that definitely will affect us. So because working together, ensure that no one is left behind. So that the first part. So the second part is the stand with sign. So at the same time, collaboration only is not enough. So we must ensure that our action are guided by science and evidence. So in today's world where misinformation can spread rapidly, so standing with science is more important than ever. It means that we must trust credible evidence, making informed decision, and translating research into real world impact. So because science gives us knowledge, but only if we choose to use it, that we are moving to the right direction. So with these two team together, so at the center is the collaboration and evidence. So this is what the team is really about. Not just working together, but working together guided by science. We need to work something based on the evidence, where the evidence mostly come from science. Because if we collaborate without evidence, so it will be not effective. So, and if we have evidence without collaboration, then we not reach the people who need it the most. So it's just a waste of the evidence. So those two need to be together. So when we bring these two together, we achieve a better health outcome. Okay, now I would like to focus on the uh, different part of the team separately. So let first look at the first part of the team, which is together for health. First, it is important to recognize that science doesn't work in isolation. So there's no single researcher, institution or country can solve today's health challenges alone. Yeah, and because health problems are complex, they are influenced by social, environmental and economic factors. So solution must be collective and coordinated. In fact, if we look at the some of the biggest achievement in public health are things like vaccine, disease surveillance system, and even recently with the imaging technologies like AI tools. All these actually are being uh, produce a product of collaboration. So without collaboration, this will not happen. So they are the result of scientists working together with government supporting the implementation, and communities take part into the intervention. So innovation happens when we combine knowledge, resources and expertise all with the collaboration. So, and all this collaboration does not just happen with one country or one discipline. It happens across countries, across disciplines, and across sectors. So, for example, public health expert working with environmental scientists, clinician working with data science to come up with AI tool of prediction, and government working with communities to make sure that what are the policy or evidence or program has been implemented in the community. So this is what makes solution for health are more effective, scalable and sustainable. So that's why when we say together for health, so we are talking about breaking silos and building partnership that bring people's knowledge and system together. Okay, now next move let's move to the next part of the team. Stand with science. So what does stand with science mean? Yeah. So first it's mean choosing evidence over opinion. So in today's world, we are surrounded by information, but not all of the information is accurate and reliable. So standing with science means that we are making decision based on data and research. We rely on credible sources. So and we are willing to question assumption. Yeah, so we need to make sure that whatever action that we take is based on the evidence that's come from a valid research. Because in public health or in any clinical field, decision based on opinion can lead to serious consequences. And so we must anchor our action in evidence. Okay, second, it means actively countering misinformation. So we are now living in what we call infodemic, since especially after the COVID-19 pandemic. all information comes, everybody relying on the online information. So there's a lot of information. Yeah, now we have we call it like infodemic now. So where false information spread faster than the evidence. So that's the problem. So because of this misinformation or false information, it affect our health program, yeah, things like the vaccine. So it affects the vaccine confidence, affect the behavior of community to look for health, and also affect the public trust toward the health system itself. So standing with science means that we do not remain passive. So if we hear false information, we as the I would say the expert in our field, we have to come out and challenge the misinformation, provide the evidence, and communicate clearly and help community to distinguish fact from the false information. Because protecting science also means that we are protecting trust in the public. So if this we fail to secure the public trust, then whatever information, whatever program that we want to implement, that will be difficult. And then the third one is perhaps the most important is standing with science mean turning knowledge into action. Yeah, we generate lot of evidence, but how many percent only actually been translated into action and give impact to the community. So we already have a lot of evidence. We now we know how to prevent disease. We know what intervention works. We know what tools that we can apply to support our decision or support our health system. But the real challenge is, are we translating this knowledge into real impact? Yeah, this is when the implementation become critical, because science, yeah, our research sitting in a journal or the thesis doesn't save life. So this need to be applied. And science is not just about discovery, but it's about making an impact. From what is the finding from our research, we need to make the impact from that. So that's why Together for Health, Stand with Science is really relevant at this moment. Yeah. The first thing is because we are currently at a critical moment in global health. Yeah, like I mentioned, we have the misinformation spread, which is faster than the evidence, particularly through social media and digital platform. And at the same time, the trust in science is declining. Yeah, because of that misinformation also, and because of we as the academician, as the researcher, did not go forward and try to encounter or fight back with the fact in the maybe I know that many of us not active with social media and digital platforms. So yeah, I'm talking about myself also, but I think this is how we have to improve ourselves. We need to try to make a way how we can tackle this information, because nowadays all the information come through social media, through digital platform. Okay, because we don't want this declining in trust in science, because this will create a dangerous gap where when they don't trust us, they will make decision based on maybe fear, confusion, or false information, and then this definitely will affect health outcome. Yeah, like example that I mentioned, like things like vaccine hesitancy, delayed treatment, and poor behavior. Next, at the same time, we are facing increasingly complex global challenges. Things like climate change, which already impact health through heat wave, vector-borne disease, and disaster. And we've seen emerging and re-emerging infections much more frequent than before, like what we have seen recently with COVID-19 pandemic. And also things like antimicrobial resistance. This is a silent but a growing threat to us, that could undermine the modern medicine, because we know that antibiotic is one of the great discovery that help to cure our patient, but with the threat of AMR, that could undermine the use of antibiotics. And this is not isolated problem. They are interconnected, cross-border, and require coordinated responses. So no single sector, country, or discipline can solve this issue alone. So we need a collaboration together. Yeah? So not just science. We need the science not just for the sake of knowledge, but we need the science that how we can translate that evidence into policy. Yeah, how to implement that evidence into a real world, and how we can make that program or the knowledge accessible to the community. Yeah, so that's where when the both part of the teams came together again. So we need to collaborate, need the sign to get to guide this action. So when we talk about the modern health threat, so we cannot the lead take the address this modern health threat in isolation. Yeah, because traditionally when we deal with a health problem, we tend to think about the health in a separate domain. So if you are in the human health sector, you just focus on human health. If you are working on treating the animal, you just focus on animal health. And then those working in the environmental health, they just focus on the environmental health. So, but in reality, these all are actually interconnected. So they are deeply interconnected. That's why we need a one health approach. Yeah. So what is One Health? Yeah, One Health is actually an integrated approach that recognizes human health, animal health, and environmental health, and it's deeply interconnected and interdependent. So that means that we cannot look at one aspect at isolation anymore. So what affecting animals will affect human. What happens in the environment that will shapes a different pattern, exposure, and risk that will give impact to human as well. So in other words, health is a part of a shared ecosystem. So because of this interconnectedness, One Health promote collaboration across multiple sectors. Yeah, this include the public health, clinician, veterinary medicine, environmental science, and then also now increasingly feel like data science, the computer science, all these need to work together how to address one problem, a health problem. So now we understand what is One Health. So let's look why One Health is so important. Okay, first looks at zoonotic disease. So One Health plays a critical role in detecting and preventing disease that move from animal to human. So we've seen this with COVID-19, Ebola, and in fact, majority of the emerging disease or infectious disease is actually come from animal. Okay, so this means that if we only focus on human health, we are already too late. Yeah, prevention must start from the animal and environment interface. Okay, next issue is on antimicrobial resistance or AMR. So this often described as a silent pandemic because we know that antibiotics are widely used not only in human but it also used in animals and agriculture. So we in the human health probably always think that antibiotic just matter to us, important to us, but it actually has been used widely in animal and agriculture. So without coordination, misuse in one sector can drive across all sectors. So that's why One Health, it will ensure better regulation, better surveillance, and responsible use of antibiotic across human, animal, and food system. All right. And then the third one is environmental health. Our environment plays a fundamental role in shaping health outcome. So issue like deforestation, pollution, and climate change. These all directly affecting both animal population and human health. For example, habitat loss increasing the habitat loss because of increases human that will lead to close wildlife contact, and climate change after disaster will alter the disease transmission. So protecting environment is also protecting our health. And finally, global collaboration. Like I mentioned before, One Health require coordinated effort locally, nationally, and globally. Yeah, because health threats not they don't know borders. Yeah, if you have an outbreak in one area without controlling the spread, it will cross anywhere. Doesn't matter. There's a they don't know boundary. Yeah, and there's no single country or discipline can manage them alone. So, collaboration will ensure shared knowledge, coordinated response, stronger health security, and also it will reinforce all the data that we have. Right. So now if we look at the figure here, we can see that there's a significant burden of zoonotic disease globally. Yeah? About 2.5 billion human infections are annually come from zoonotic origin. And then beyond health, when we talk about health, it actually will impact economic and agriculture disruption. What happened, what we see with COVID-19, when we have the pandemic, the impact not only towards health but also to the economic and overall living. Yeah, so this highlight that One Health is not just a concept; it's really a necessity. And then that's why this year the WHO choose the theme of Together for Health Stand with Science. Yeah, it requires us to work together across sectors. And then to remind us that we do not live in isolation. Yeah, we need to work together to protect our health. Okay. Let me now talk through how disease actually move from animals to human and eventually to pandemic. So this process is what we call spillover. If you look at the figure here, at the center, we see virus. Virus is actually circulating in natural reservoir, often in animal like bats lah. So they occur naturally there, and then this animal that carry this virus usually they don't get sick, because it is actually a natural reservoir for the natural host or for this virus, so they don't feel sick at all. So at this stage, the virus will actually contain within wildlife. So, and then the next, when there is a opportunity where the wild animal close together with the maybe domestic or livestock animal, so that lead to the move or jump from the wild animal to the intermediate host. Yeah, this can be livestock, wild animal, or even the human can be the intermediate host. And then here, this virus can either mutate or they adapt to a new species so that they can actually infect human. So this is where spillover occur. And especially when we have a high risk setting like in a wet market, deforestation area, agriculture, expansion zone. So when you disturb the natural state of this virus, that will lead to the spillover. So this is where the first human case can occur, and then we usually call this the index case, the emerging case. So surrounding this, we have a transmission host where the virus begin to cause disease, spillover host where infection can become severe. So here the example that we can see here, avian flu, SARS, MERS, Nipah virus. So all these pathogen or virus are present in nature. They're just waiting the right time or the right condition for them to cross over. So how does this jump actually happen? So the first in their natural reservoir. This process begin in the natural reservoir. For example, bats in certain region, they carry a wide range of virus. Okay, mainly many coronavirus, and then when it go to the intermediate host, okay, this can transmit to human, and it can spread rapidly either through travel, urbanization, and global connectivity. And so this spillover is not a random event. It's driven by how we human interact with the animal and the environment. That's why we need the One Health approach to prevent the process to occur. Yeah, because the reservoir is in animal. The drivers are the environment and our behavior. So without tackling these three, we cannot prevent the next outbreak. So if you want to stop future pandemic, we must intervene before this spill over. This is where the One Health approach. Yeah? So each stage, at the animal stage, at the environment, to prevent the wildlife, all are needed to be done before it's occur in human. So another example is antimicrobial resistance. How that um, there's a cycle between human environment and animal there. Yeah? So if you see this slide, it shows that AMR is not just a clinical issue. Yeah, in the past we always see AMR in the hospital, a problem in the hospital. It is actually a system or what problem that move across human, animal, and environment. So antibiotic are widely used, yeah, like I mentioned, it's not only for human medicine but also in food production, yeah, animals. So when these medicine are sometimes overused or misused, so drug resistance can develop in animal. Okay, and these resistant organisms do not stay isolated. They can spread to the environment, contaminate our food, and can eventually reach us human through the food chain. So that will affect us. So we become develop the resistant to antibiotic. So once transmitted, this infection become much more harder to treat, leading to much more severe illness, longer hospital stay. So that's why addressing the problem of AMR require a One Health action. Then the next one, this slide show how the cycle of the AMR, how this resistant bacteria continuously to circulate between human, animal, food system and environment. So when antibiotic are used, especially if we use don't not use it appropriately, bacteria are exposed and can adopt. They become resistant. So these resistant bacteria can spread from human to the environment. Yeah. So we just throw a leftover of the medicine to inappropriately, that wash through the water source. It go to the agriculture and food system. So at the same time, then the use of antibiotic in livestock also can come into the cycle as well. So it is like a cycle. So it's not just only the use of antibiotic in animal or in farm, but how we misuse the antibiotic also can lead to this cycle that will continuously lead to AMR. So again, I want to highlight the importance of One Health, where at each sector they can take action how to prevent, how to stop this cycle to occur. So now we understand the concept of One Health. Now looks at it, the key focus area for One Health. Okay, they are the first one is prevention and response. So One Health strengthens our ability to prepare for pandemic because we can detect threat early and respond effectively. Yeah? So by integrating data and expertise across sectors, we can identify risks before they escalate into outbreak. Yeah, this is especially important for zoonotic disease lah. Like how I mentioned before. Second is sustainable ecosystem. Health is deeply influenced by the environment. So we see like deforestation, biodiversity loss, climate change. So this also increase risk of emerging disease. Yeah, because the habitat disruption brings human closer to wildlife. Climate change expand the range of disease vectors. So again, this emphasize why One Health is important. And the third one is food safety. So our food system are closely linked. Okay, so safe food production, proper use of antibiotic among animal, proper monitoring of animal health, that will actually give impact on us. Yeah, so globally there's this partnership they call quadripartite partnership, WHO, FAO, which is a food and agriculture organization, WOH, World Organization for Animal Health, and UNEP, United Nations Environment Program. So this organization, they are work closely, collectively to align policy, strengthen collaboration, and to promote integrated health strategies to balance and optimize health for people, for human, animal, ecosystem lah. Because any disruption in animal health or environment health will ultimately affect human. Okay, let's see the comparison between the um, traditional, a siloed approach and the One Health approach. Let's first we look at the detection. So in a siloed system, the traditional way of doing it, we wait until we have a case among human. Oh yes. I see a hands on, or is it just by mistake?
Yes, Prof. We may have around 1 or 2 minutes to complete the session.
Oh,
Sorry.
okay, all right. Thank you. I try to speed up. All right. Yes, just to compare how the both approach. Traditionally we always wait until we see human get sick. When we see outbreak from human, then we can take action. But with One Health, we be a proactive, detecting the cases among animal, detecting the problem in the environment. Same with data sharing. Traditionally, all the data keep fragmented. Data among human only focus within the human health. In the animal only keep within the animal health. But with a data sharing, that actually can trigger us for a better early detection, because any alert from the data, either in animal or environmental health, that will actually give an early warning to us in human. So same with intervention. Anything intervention treating human mean it's too late. We need to start the intervention at in the environment or in the animal as well, so that to prevent the cases occur in human, because they will lead to a long-term outcome. All right. Okay, this is just example on how that, fragmented response, what happened with COVID-19. We see that because of the working in silo, we have a late detection, maybe strategy is not effective, that resulted in a global pandemic with COVID-19. But one success that I can share, that in many in South Asian region, that how we control rabies, where in rabies is one of the disease that we work very closely between human and animal and other organization like NGO, with the detection in animal, and also tracking the cases in animal, that alerting the cases in human. And also the strategy of prevention also start back with the animal. That leads to the reduction in the cases in some countries that we can see. Okay. So now we know that One Health is important. Yeah. But working together is not easy. Yeah. How to work together is not easy. Why is it so difficult to implement? Because working together with different sector, you have to understand each other's roles. Yeah, communicating. I mean, there's a complex issue also. Yeah, it's easy to say than done. It's easy to say you have to work together. Yeah, but it's actually difficult to do. Yeah. Many One Health initiative not fully implemented, still remain working in silos. Yeah, because sometimes one still the understanding or awareness on One Health is still limited. Policies might not be aligned. Resources are limited. So coordination is really a challenge. Yeah. So the implementation gap in One Health is actually still there. So that's why it's actually difficult to make it happen. But yes, I think I can see that now people now increasing understanding. We are moving towards working together in One Health. But it is not something easily be done. Really need to put a planning and effort and policy to make sure it can be done. And when we talk about translating evidence to action, it's not only just the One Health, the all evidence, yeah, all whatever evidence that we produce, yeah, in health, yeah, most of the time we know what it works, what medication is work, what intervention is work, but how to implement that in the community is really a problem. So this is where then we have a implementation science come in. So this implementation science can give a gap between what are the knowledge that or evidence that we produce in the hope that we can sustain a health impact in future. So as a summary, if you have a medical response alone, it's already just a damage control because it's a bit too late already. Yeah. So the true prevention occurs um, happens much earlier, yeah, at the environment and animal level. So the next pandemic will not be stopped in hospital, but through early detection, collaboration, far back in environment. Yeah. So that's why we need this unity, teamwork to work together under the One Health approach. And strong evidence is only the starting line. Yeah, our focus in how to shift to the other side, how to close the gap, how to implement, how to sustain the evidence, and in the end give impact to the community. Okay. And to turn evidence into impact, we need everybody, all the stakeholder. This one I just highlight a few: policymaker, researcher, communities. Yeah, all us lah. Need to work together and play our role so that this evidence can give impact and give benefit to the community in the end. So, today's we are reminded the health is not something we respond only when um, we have seen disease in human, yeah, but we must consistently work using the One Health approach. So that's why I'd like to remind again this year team, Together for Health means that no one's work alone. Standing with science means that we must act on evidence. So if we combine this, we hope that we can build a healthier and more resilient future for all. So I think with that, I would like to thank those who actually listen to this talk, and I will pass back the session to Dr. Mila. Thank you.
Thank you so much, Prof. Rafdzah. It is a very insightful talk. Yeah, we may need to base on the scientific evidence and working together for the betterment of the community. So, yeah, thank you so much for highlighting about the importance of One Health as well as the implementation research in the context of these days. Because of the time limit, probably we may not be able to take the Q&A section at this moment. And is it okay, Prof? So for those who would like to ask the question, probably you can type in the chat box, and then we may be addressing this later on if we have some available time. And again, thank you so much, Prof, for the section. And I would like to conclude the first section of the One Health approach. And I will pass it over to the Ms. Liana. Thank you so much.